Well, Xi Chen now joins us from New Haven, Connecticut. He is an associate professor of health policy and economics at Yale School of Public Health, also the former president of the China Health Policy and Management Society. Thanks so much for taking time to talk about this. This is an important issue, and as we mentioned earlier, some 400 million people are going to be considered senior citizens in the very near future, and we've heard about what China is doing to combat this, but also the pushback. We just heard from people who don't want to have 3 children, worried about the cost. China's in a very tough position right now.
Thanks for having me. Glad to join you. And it's indeed very burdensome and challenging to manage aging society. And this is not only the challenge China is faced with. All the countries in the world have different degree of population aging. I think it's true that population aging and the lower fertility is a challenge, but quality of the population is also equally important. How to make a better investment in the health and education of the population would be very important to make sure the quality of the population, the enhance of that is more than offsetting the reduced population size. And China has been doing many things like pension policy reform, retirement, thinking about retirement reform, or supporting the young couples to have more babies, but those take time. But I would say the cost of inaction would be very huge and fast accumulate. So it's very important to act now, because everything we do now to facilitate, to support the family will take effect more than 20 years later, because the newborns will have at least 20 years to enter into the labor market.
You know, Xi Chen, you're exactly right when you say that virtually every nation, the United States, everybody is dealing with this right now, and it's going to get worse as the baby boomers come of age. For example, India is poised to overtake China in global population to be the most populous country on earth. What do you think about when you look at China and it's facing this? What do you think the biggest hurdle is right now?
Yeah, I think there's 4 hurdles. One is the socio-economic change, how to manage retirement. In China, it's very young retirement age. How to make it more flexible to facilitate people who are healthy to work longer and support them after they retire to enhance the pension system. As the documentary was saying, China has been enhancing the 3 pillars of support, and especially the 3rd pillar is the most weak, and because there's a lack of individual account of pension. So that's important as we growing older and we live longer years after retirement. The second is the demographic transition. Population aging is not only about aging, it's also about the lower fertility. How to build the old age care system. So that require the all hands on deck approach, like a social government community all involving, like a nursing home, community-based support and family support. And the 3rd is that we don't need to, we have to pay attention to the epidemiology transition, because originally when people were young, they have a lower life expectancy. People would have trouble with acute disease, but now people need to manage the chronic conditions, and the current health system is not very good at managing the chronic conditions. And so like the big hospitals, hospital-centric system has to be reformed to integrate a different sector of healthcare to manage preventive care until the end-of-life care. And the last thing I think is urbanization, migration make this process very uneven. How to build an age-friendly society, especially in those aging faster, like in out-migrating provinces, or those in rural counties. So they are more older people like concentrate living in those areas. How to build the social institutional care system to take care of them. That's the key.
Yeah, and one thing Asia is well known for, especially China, their children taking care of the elderly as they push into these golden years. What kind of burden does this put on young men and women as they're trying to make their own way in the world, this very modern China right now?
Indeed, I think we always have a term called the sandwich generation. So the children in the middle age have to take care of the kids and also their parents, and their 4 parents, parents and the parents-in-law, and they also need to go to work. So I think there's a big challenge, but also some solutions. For example, many countries are piloting like the family paid leave policy to give more flexible working hours, working schedule for kids to take care of their parents. And I think also in China, particularly, older adults really prefer community-based care or family-based care. So I think the long-term care policy, the long-term care insurance have to reimburse those informal caregiving in addition to formal care like the nursing facilities and community-based care. All those forms of care all together will make sure they will take care of all the prevalence of the older adults in China.
Well, Xi Chen, as always, we certainly appreciate your insight. Good stuff. Thank you so much.
Thank you.